Several different areas of the brain regulate mood. Neuroimaging studies of healthy and depressed patients have shown different patterns of metabolic activity of these different regions. The brain regions involved in mood regulation are connected through neuronal pathways. These neuronal circuits communicate by releasing neurotransmitters. When there is an appropriate amount of neurotransmitters within these pathways, communication between brain regions is optimal and the mood circuit functions normally. However, in depressed patients, neurotransmitters become depleted or dysfunctional, and communication between mood regions is disrupted. Increasing the amount of neurotransmitters is an established approach to treating depression. Neurons and their release of neurotransmitters can be affected either chemically or electrically. Traditionally, drugs have been used to chemically increase the amount of neurotransmitters. However, because antidepressant medications are systemic, they elicit undesirable effects in the brain and throughout the body. NeuroStar TMS takes a different approach, exploiting the fact that neurons are electrochemical cells. It uses a targeted electromagnet to produce a pattern of pulsed magnetic fields. This electric current is powerful enough to elicit an action potential in neurons, causing the release of more neurotransmitters at the synapse. In addition to these local effects, NeuroStar TMS activates deeper brain regions that lie outside the direct action of the pulsed magnetic fields. Energizing these deeper brain regions causes secondary activation of brainstem neurotransmitter centers, which stimulates other brain regions involved in mood regulation. NeuroStar TMS therapy offers a unique mechanism of action by directly depolarizing local neurons, which modulates connected deeper brain regions. This allows NeuroStar TMS therapy to affect both local and deep neural circuits, all without causing unwanted systemic side effects.
What we need to make people aware of is that transcranial magnetic stimulation is an innovative science that treats depression that has been FDA approved now for almost 8 years. It's mainstream treatment in psychiatry, but the awareness of it has not hit the full general public, and it hasn't even fully integrated into the full medical system. You know, there are 4 or 5 machines that are seeking FDA approval, and not just for the original diagnosis of depression. Since it's been introduced, and the original company NeuroStar has now had its millionth treatment, it's also has expanded across Europe, into Asia and Japan. And ability to treat patients with a device that doesn't cause drug interactions, doesn't cause medication side effects, and is more effective in combination with the therapies and the medications that people have, and that makes all of these things work better, and that we've been able to treat patients who have been untreated before is an amazing miracle, and has created a tremendous amount of hope in a field where treatment-resistant depression lent itself to tremendous cost to individuals, families, and society, where billions of dollars are lost in work days, people commit suicide, families are destroyed by the pain of depression. 1 out of 4 people in the United States has a psychiatric illness, and only 1 out of 4 are treated. And in the specific diagnosis of depression, there are 14 million people diagnosed every year. Only 7 million get treated, and only 3 million are adequately treated. And so it leaves all of those people, 7 million plus 4 million, that have not been able to get help. And medicines in studies have shown that even when you try full trials of medications, through the course of a year, maybe 4 medications, only 67% of people are actually successfully treated, and there's a third of those patients are untreated. And this technology not only takes care of the treatment-resistant patients, but some people are seeking this out before they even try medications because it's a cleaner treatment. The business opportunity of this is that since the pioneering work of 2008, and why has this become mainstream, it's accepted by almost every insurance company now in the United States at different reimbursements. But even at the lowest reimbursement rate of Medicare, we have business models that show a terrific profit for centers of excellence that are able to sort of really understand depression and treat them in a biopsychosocial way. Okay, so there's, I guess, three different concepts here. One is, what's the opportunity from a business point of view? What's the opportunity from a clinical point of view? And then how does TMS and depression work? TMS is a new science that is treating other illnesses as well. And while the indication that's used right now in the United States officially for the insurances is depression, it has been demonstrated to be effective for migraine headaches. It's been demonstrated to be effective for anxiety. It's been demonstrated to be effective for PTSD. It's demonstrated to be effective for people who have Parkinson's, autism, and mild cognitive impairment, the beginning of dementia and Alzheimer's disease, fibromyalgia. Currently, the FDA is reviewing an indication for dementia, for mild cognitive impairment. So when you develop these centers and build a business model around depression, you can have that same center be the pathway through the door. People can enter it with their diagnosis of depression or whatever, and they're coming to that expert center of excellence. But the marketing can be done in different disciplines, so that you have dementia, you can have fibromyalgia, you can have anxiety, and it's the same center as people come in. And while those are off-label uses, as we do for other medication, we know that people are also willing to pay out of pocket. So we have, options here. That means that when we build and show you our models that are just built on depression, and we built the models on the lowest reimbursable rate, we show a tremendous profit. When you think about what the upside is, that you can get other insurance companies with a higher reimbursement rate, you get people who private pay, and you have 5 or 6 or 7 other diagnoses that people can enter in to get treated. The models that just show simply, how we make a profit with a Medicare reimbursement on one diagnosis, the upside of this is really underrepresented.